First of all, I would like to thank everyone. This is not the last day, but as far as I know, there are no presentations for tomorrow. There are only working groups. This is the last session. I'm the last speaker, and thank you very much for having the patience and listen to me. I have a different topic I will discuss, and I hope I won't bore you too much and will be able to convey some important information to you. I will do my best not to bore you. During my presentation, I would like to show you some of the pictures from children in the refugee camps in the eastern parts of Turkey. Although they live under very poor conditions, they have the smiles on their faces, and which is very nice. In one part of our professional careers as physicians, this is some typical phrases that we come across, especially when working in the emergency department or when we were students. And now we understand your problem, and now we will give you a very effective drug that we have imported from abroad, and all your problems will disappear. Probably you've heard similar phrases. The roots of the word placebo, I don't know if it's the Turkish word for it, but its origins date back to the 14th century. The word has been derived from the Latin word of I shall please. On those years, and people would be hired to weep after the deceased people against money, and they would say placebo domino id regionane viviorum, which means the family members who are supposed to cry after the deceased would employ those people who would cry in their steads, and these people came to be known as placebo. In 1811, first of all, it was introduced in the Quincy Medical Dictionary. Then it was defined as treatment methods that don't cure the patients but make them happy. After it was introduced in literature, and it was also used in the studies. The first placebo-controlled study was done in 1899. The placebo effect has been observed since the first times of the history, and it's being used. You can see it in many places. It underlines the fact that the trust that the patient feels towards his physician and the treatment is very important. And Galen said that people who have more confidence are better treated, and Hippocrates said if the patient is given information about his condition, there is a significant improvement in their condition. Although the mode of action is not well understood, for thousands of years placebos were used by the physicians, and even before that by the healers, by shamans, as well as by other witch doctors. Today, if you look at the situation today in terms of the placebo concept, it's a treatment method that is administered by the physician without any known pharmacological effects. So placebo is any kind of additive without a pharmacological effect, such as candies. And unpure placebo has an effect on certain conditions, but not an effect on the addressed condition. If you look at the placebo effect, the response or the patient's response to a treatment which may not be attributed to the pharmacological effects. If you look at the mode of action of placebos, although it is not clear, many factors are involved. There are multiple mechanisms that play a role. If we look at the most important ones, expectation and conditioning is very important, which means so doctor says, I will give you a drug and it will make you better. Just this phrase creates an expectation in the patient, and this may contribute to the improvement. Anxiety alleviation mechanisms like suggestions like it will get better may be effective. Certain reward circuits may be activated in the brain. Social learning is very important too. Studies have shown that if you give a placebo to a patient, the placebo effect is not very high. If you give other drugs to treat the patient and then start placebo in the patient, we see more effects associated with placebo. Thus, social learning plays an important role. Genetic and personal characteristics they induce neurochemical mechanisms in the brain of the patient and may cause certain effects to arise. If you look at the neurochemical effects, beyond psychological effects, placebo may trigger certain neurochemical mechanisms in the brain. This has been identified, especially endogenous opioid system, endocannabinoid system, and nucleus accumbens, natural reward mechanisms, and dopamine seem to play a role. When you look at the mechanism of effects and the differences in terms of the mechanisms have been studied too, the number has been found to be effective in a study that was conducted, and it was found that patients who get 2 pills instead of 1 pill can focus better. Color is important too. Pink tablets can focus better than patients who receive red tablets. Being new, the packaging, the capsule form are found to be more effective compared to tablet forms. Price plays an important, and their effect changes too, and the seriousness of the intervention is important too. There are some patients who don't get better until you give an injection. So the greater the impact of the treatment that you offer, the more pronounced will be the effective. Placebo is not limited to an active drug. It could be an inactive tablet. It could be a regular contact with a clinician, a relationship with a caregiver, adult caregiver, being admitted to an inpatient unit without any treatment or intervention, or only scheduling an appointment to a clinic. And even after this appointment has been scheduled, some studies show that there is an improvement in the condition of the patient. Such interventions can fall under the definition of a placebo. Although there are certain neurochemically measured effects, although partially, the placebo's effect is quite different to the response that is given to the active drugs. This improvement is usually subjective, which is much shorter lasting compared to patients who are treated with active ingredients. There's a study that was conducted in 2011 on asthma patients, and 3 different methods were used. One of them was albuterol, which is an effective treatment for asthma, a spray without an active ingredient, and sham acupuncture was used. And before those treatments were given to the patients were asked how they feel, and the same question was asked before and after the treatment, and whether the treatment was effective. As a physiological test, FEV1 was performed. After all the treatments, all the patients reported that their symptoms have improved, that they were feeling better. So in terms of subjective reports, there was an improvement in all of the patients. However, if you look at the test results, only in patients who received albuterol, there was a 20% improvement in the lung functions. Thus, so there is a question mark whether the improvement reported by the patient is real. Placebo in children in 2013, there was a study that was performed, and based on a PubMed search, around 155,000 results were produced. However, it was combined with the words children and adolescents, the number goes down to 50. That could be a couple of reasons. One of them, there may be legal and ethical restrictions for studies on children and adolescents, and plus, it could be due to lack of interest in those studies, especially in children under 6. The data is very limited. In 1998, NIH there is a statement that children should not be included by studies conducted by the NIH unless otherwise indicated. FDA says drug companies have to include children in all the indication studies, and about substances that are tested in children, a 6-month marketing process should be added. This may enable an increase in the number of studies with children. While the number of studies is increasing, there are certain legal restrictions that are imposed. According to the Helsinki Declaration at the 2008 meeting, there are certain restrictions that are imposed on placebo-controlled studies. A new intervention should be tested against the best available treatment. So when you want to perform a placebo-controlled study, you should not use a placebo. You should compare the test drug against the best available treatment, so which limits or restricts placebo-controlled studies. It's a challenge to perform them. And if you look at it from the ethical perspective, there are 4 ethical principles that apply to all human subject studies, especially in terms of informed consent. And in terms of informed consent process, there are some question marks. Even though you explain to the child what placebo is, the child may have difficulties comprehending the meaning of placebo, and these are certain ethical concerns that have to be taken into consideration when performing a study in children. In 2002, they did a workshop on the use of placebo on children, and they made a statement under which circumstances placebo-controlled studies can be performed. I selected certain examples from them. If there is no therapeutic standard medication, or if there is a standard medication, if the inclusion of placebo will answer an important question, in all of these circumstances, placebo should not impose a risk on the patients, and if the provided treatment has significant risks, and if a new intervention with a safer profile will be studied in terms of safety and effectiveness, there are no problems to include the placebo. Placebo-associated risk in the previous slide, there was no risk at all. Say there is a minimal risk, or even a bit more than minimum risk associated with placebo. However, the existing treatment has more serious side effects. If an extensive placebo effect was observed in other studies, in order to answer scientific questions about the effectiveness of the active drug, and we should identify the response to placebo, and if the standard treatment is very expensive, in those circumstances the use of placebo can be considered. If the non-treatment increases the risk, if failure to provide the existing treatment will cause minor or more than minimal damage, we should never use placebos. Is the response rate to placebo different among children and adolescents? Most of the time, placebo response is more pronounced in adolescents than children. In a study conducted on children, the placebo effect was demonstrated in 54% under the age of 12, and it was 44% when they were older than 12. So in young children, you have a better placebo effect. In a similar study conducted in adults, the placebo effect was reported around 35%. In epilepsy and migraine studies in younger patients, placebo effect has been shown to be high and was found to be comparable to the drug effect. In ADHD studies, the average response to placebo in children was between 20 to 30% versus 10% in adults. In functional abdominal pain studies, there are comparable results. In a psychiatric disorder study conducted by a Cohen, it is a systematic review, anxiety disorders, OCD and AMD patients, it was shown that the placebo effect reduces parallel to the age. In all the age groups, while the placebo response is low in anxiety disorders and OCD, there was a good response to placebos in AMD. Is it the same mechanism in adults and children? Because we have a better response rate in children, but maybe the mechanism could be the same. It is suggested that there are similar mechanisms that are in place in children, especially mimicking and role modeling is more widespread in the children. Maybe the high learning capacity in children could attribute to a more pronounced placebo effect. Parents taking responsibility, and because they focus on their attention on the symptoms, may increase the expectations in children. Inclusion to the studies, and sometimes the parents may exaggerate the symptoms in the children, and shortly after inclusion in the study there may be an improvement in those symptoms. Based on the meta-analysis results of 31 depression studies conducted in children, it was shown that the placebo response in children was not found to be related to the contact time as well as switching of the active treatment. In the placebo-controlled studies, the duration of the therapeutic contact is increasing the placebo effect in adolescents. However, in smaller children, such an effect has not been observed. Because the patient expectation has a positive effect on the response, but it's not effective in small children. Are there any other factors? In adult pain studies, there was a better placebo response in male gender. In 2 analysis studies conducted on children, there was no difference between the genders. In the second one, there was a better response in girls. There are not many studies on personality traits, but predisposition or inclination to suggestions or negative expectations could be effective. In Newcorn ADHD study, in easily distracted who are naive to stimulant therapy and who have comorbid tics and who are non-Caucasians have a better placebo effects. Cohen studied anxiety, major depression, compulsive behavior, non-Caucasian race, the disease duration, etc. are related to the placebo non-response. In aggressive children with behavioral problems, a better placebo response has been shown in patients from families with an aggression behavior. The beliefs of the families, the attitude of the family towards the children and their stress level has an important effect on the physical and psychological functions of the child. In case of an anger tantrum of the children, there was a survey conducted using phone calls, and there was a significant resolution and symptom reduction is being found to be correlated with the parent's attitude. What is the situation in the psych studies? If we try to quantify the placebo effect, because we know it's high, the education of the investigator, the scales that I use, whether they are validated, number of centers that participate in the study may play a role. The source of information is very important. In our own clinical practice, this is a frequent observation. There may be significant differences between the parents, so we should try to collect from multiple sources. So if you establish a diagnosis based on information collected from a single source, there may be a wrong conclusion in the study. And studies show that placebo, there's a concept called perceived placebo. When the doctor prescribes a drug, even a placebo, the parents report that the symptoms are decreased. The child does not receive a real drug, but the behavior as well as the symptoms improve. Even the physicians, especially in ADHD, if they think that a child receives a real medication, they have the misconception that the symptoms of the child may improve. There may be sponsor-related factors, there may be some factors related to the study design, insufficient assessment of the patient, and how the results are interpreted, and when they are interpreted, it might be important, especially in terms of long follow-up. There may be a placebo effect initially, which may wear off over the time. The average placebo response in MD is around 50%. In OCD, it's 31%. In non-OCD anxiety disorders, it's around 40%. In ADHD, it's 30%. In schizophrenia, it's between 45 to 35%. Of course, the number of studies is limited. In bipolar depression, the response rate was around 67%. In the MD studies, the relapse rates are significantly higher in placebo. The depression intensity, and there may be differences in terms of mechanisms among children and adults. There may be differences in terms of inclusion criteria and industrial support of the studies may be responsible for the placebo effect that varies between 17 and 60%. If you look on non-psychiatric conditions, migraine, prophylaxis and treatment, partial epilepsy, and in pain and functional GI disorders, a high GI placebo response has been observed. There are a couple of studies on ADHD, especially while the treatment is going on. by reducing the dose of the medication to reduce the side effects. They just wanted to add placebo. Placebo plus 50% reduced dose of a stimulant treatment have a similar response to normal treatment, and there were less side effects. When talking about placebo, we should also touch upon the concept of nocebo. Nocebo means in Latin that I will harm you. In contrast to the placebo, sometimes some adverse effects can be observed after placebo. Although the effect is missing, we may observe some of the adverse effects that may be associated with normal drugs. What are the problems related to placebo effect? From the ethical perspective, there are some concerns. By telling the patient that it's effective and it's like deceiving the patient, this is really not ethical. Another ethical concern is the great number of alternative medical practices that don't have any proven efficacy, which is quite common in our field too. This is also true for other types of medical conditions too. So people have question marks whether the placebo effect is really effective. And it may be abused as a marketing strategy. We just touched upon it the same. Medication, although there is no difference, only changing the form, the color of the capsule, and then it's reintroduced in the market, and then it may be abused. There are some conditions that may be confused with the placebo effect. Some of the diseases may resolve on their own spontaneously without doing anything. You may observe an improvement in the patient's condition. Some conditions have a fluctuating course, and returning to the average may be confused with the placebo effect. And confirmation prejudice may cause an improvement illusion. We may focus on the positive things but neglect the negative aspects of the treatment. In conclusion, as much as the treatment method that is given, patient-physician relationship is also very important. This underlines the fact. So having a good rapport to the patient is very important. Thank you very much for your patience.